Hello, do you know that an average Nigerian between the age of 15 and 45 is under the influence of illicit drugs? Join me and welcome my guest, Dr. Rotimi, and my colleague, Adedolapo, myself, your humble DMO.
Welcome, Dr. Rotimi. How are you today?
I'm fine, and you?
I'm very well, thank you. We are so happy to have you here today. So without further ado, we just want to quickly shoot to the reason why we are here. And we wanted to speak to you about drug abuse. Dr. Rotimi, what are the physical symptoms or signs of drug addiction or drug abuse?
Okay. Thank you very much. Thank you, DMO, and thank you, Adedolapo. So, usually I like to approach issues of drug abuse with knowing the drugs or substances that are commonly abused, because most times a lot of people don't even know alcohol is actually a substance of abuse, but many people actually overlook it. Codeine, which is a component of a number of cough syrups, is also a substance of abuse. And that's why you see a lot of people that will tell you that, oh, I want cough syrup. They try to go over the counter to get certain cough syrups. Tramadol. Now, the interesting thing is that tramadol is actually a medication for pain, but a lot of people use it because of the feeling of euphoria that they can get from it. Now, there are some common ones that we know. One of them is crystal meth, which is also known as methylphenidate or the amphetamines, which some people call munkbumiri. I think it's some parts of the East. Now, that's another common drug. Cocaine is also another one. Then the one that is literally almost like endemic now amongst the youths and people of the teenage group is cannabis, also known as marijuana, also known as weed. Now, these substances are taken in different forms. Some, they are smoked. Some, they are snorted, that is, you sniff them through the nose. Some are even ingested. You've seen people that put some of these things in food. Now, basically, these substances affect one part, not just one part of the body, but they usually have a key effect on the brain. Now, there are some chemicals in our brain that helps with our mood, that helps us to appreciate pleasure and the likes. Now, what these substances do is that they alter these chemicals in the brain. One of those key chemicals is known as dopamine. That is the substance that is that is essential for pleasure. So when you see your favorite food, for example, when you eat your favorite food, you are watching your favorite movie, things that have to do with pleasure, dopamine has a role to play. Now, so these substances affect the level of dopamine in the brain. They generally affect how our brain works. So because of that euphoric feeling they give, there's this tendency for people to gravitate towards these substances. And now the issue with addiction is that you think, oh, I have a control over this, but you literally do not know, you do not. It's almost like you are digging a hole without knowing when to stop. Now, to the question itself, signs, symptoms, features that will point towards, oh, this person is most likely battling with illicit drug abuse. Now, for some people in the early stages, you may not know. If the person does not tell you that I have challenges with drug abuse, you may not know. And for some people, there's what we call poor insight. Some people are actually in denial. They don't even believe they have an addiction problem. For them, they feel that, no, it's just once in a while I take it. I just want to get high. I just want to feel good a bit. No, I'm in full control. Whereas they are actually not in full control. Now, the way the brain is wired, when you are exposed to these substances over a period of time, when you stop, the body starts to yearn for these substances. The body starts to crave these substances, and that's where a number of people start manifesting some of those withdrawal symptoms. And that's how you get to know some people are actually using substances. And now, because it affects the brain, in the long run, other parts of the body will also be affected. The heart, being a very sensitive part of the body, will be affected. The stomach, the mouth, and so people will manifest signs and symptoms based on this, as well as based on the substances that they are using and the routes with which they are taking these substances. Now, for some people that are into things like heroin, if you look at their skin, you could see evidence of them using injectables. You could see needle marks on their skin. So you could tell that, oh, it means this person is most likely injecting themselves. Exactly. Now, for those who sniff some of these substances, you could see them having runny nose continuously. They are always having this stuffy nose. They are always having, yes, this nasal congestion. They are almost always, for some people to say, this guy is just forming stees, but not everybody is actually forming stees. And for some of them, there's how much these substances would have damaged their nasal passages. They start bleeding from their nose.
Wow.
So that's why when you see somebody comes to the hospital and the person is bleeding from the nose, while you're asking other questions, you want to also ask and see, is this person using any form of psychoactive substances that could have triggered this nosebleed? Now, for some people, they tend to exhibit restlessness because now they are craving these substances. So they are restless, they are agitated. In fact, for some, they become depressed. When they don't have, because at a point, one thing drug abuse does is that it takes away your interest in almost every other thing. And you are not focused on that substance. That's why some people that, when they are addicted, they don't want to go to parties, they don't want to hang out, they don't want to chill with family and friends. Sometimes they don't even want to eat. They just want to focus on that substance that they are on. So they will start exhibiting things like low mood. They are not really interested in things they will usually be interested in. Yes, they are no more active. They are just seeking these drugs. Now, for some of them, their heart may tend to start beating very fast because of the effect of these substances. And of course,
that could result to a lot of things.
Oh, exactly. Now, for some other people, because of the effect in the brain, they could actually lose consciousness. They could actually tilt into coma. So when you bring people to the hospital that, they are unconscious and you are suspecting, this person might have had some substance abuse, you want to check, the urine to do what we call a drug toxicology for them to check, could it be that it is drug related? And we've seen people that, they go to parties and they added some of these substances to the cake, the brownies that they serve them. After they start from feeling of euphoria to feeling of impending doom. They start feeling like, they want to die. They are not breathing very well. They are uncomfortable. There's excessive sweating. They are restless. They are very anxious. So all these things are pointers that, it's possible that this person might have been exposed to any of these substances. So those are usually some of the features, some of the signs, some of the symptoms that these people will manifest. And of course, generally, like I said, since there are a number of substances, sometimes it could also vary.
This is actually going to be very, very much in our favor to abstain from these things, but let us still ask further questions as to effective treatments.
So what are the possible effects, treatment for drug abuse?
One, the person needs to agree that they need help. Some people do not think they need help.
Yeah.
Now, of course, there are some people that you may want to, you literally cannot coerce an adult to seek help. But whatever the case may be, rehabilitation is essential. Just the same way when you move to a new place, if you are somebody that is a staunch church goer, when you move to a new place, the first thing you want to do is, where can I get a church I can attend? If you are someone that is into fabrics, when you move to a new place, where do they sell materials? The same thing with people that abuse illicit drugs.
Yeah.
Whatever location they get to, the first thing they want to look for is where can I purchase these substances? That is the first thing they want to look for. And you will find them making friends with people that are also interested in these substances. Oh, that's why they tell you that, oh, I have a dealer. I have, because they want to make friends with those people. So those are the kind of people that they say like minds. Yes. So those are the kind of people you see them having as, oh, guy. Exactly. Flock together. I say, show me your friend and I'll tell you who you are. So it's the same thing. So most of them may eventually need to change their circle of friends. It's a tough decision.
It is.
But they would definitely need to change their circle of friends. And rehabilitation is key because most people say, oh, I can stop taking these substances on my own. Now, a few people are disciplined enough, they are lucky enough to say, oh, I want to stay away from these substances, and they are able to. But usually, those people are in the minority. Those people are usually in the minority.
Because of addiction.
Now, for many of them, it is usually very challenging. And for every substance abuse, one of the biggest challenge they face is actually the withdrawal symptoms. So each time they try to stop these substances, by the time they start having those withdrawal symptoms, and the withdrawal symptoms are usually very uncomfortable. The sweating, the tremors, you see some of them shaking, you see some of them having itching. There's something they call formication. They'll tell you that they feel as if insects is crawling under their skin. Now, these substances gives them that feel. So by the time they're having these uncomfortable symptoms, they start craving these substances. That's why I see a lot of people that tell you that, oh, I've been clean for 2 weeks, I've been clean for 2 months, and you see them, yes, you see them going back to it. So for some of them, it's not because they want to go back to it. It's because they've not been able to overcome the withdrawal symptoms that they are dealing with. They've not been able to overcome the dependence. So now, usually, everybody that has substance abuse challenge will benefit from a psychiatrist's evaluation. Now, we are in a society where when you tell somebody, go and see a psychiatrist, that statement, it's in fact, is unbelievable to some people.
It's more like an insult.
They see that, but I'm not mad now, I'm not the crazy now.
It's really okay for one to go to the psychiatrist once in a while to check your mental health.
But that's the reason why it is good to let people know.
Exactly. Now, the problem, there's a stigma. There's a stigma already when you say, oh, let me send you to a psychiatrist. But look at it. Even the relatives, the loved ones, like, he's not the mad now. Yeah. Why are you sending him? So most times we prefer to use even terms like, okay, mental health specialist, to try and make the term a bit more welcoming. Because in medicine, there are specialists for almost everything. Now, when it comes to things like substance abuse, the psychiatrists, the mental health specialists, they are the specialist physicians that manage these situations best. They have the optimal knowledge with regards to it. Now, there are so part of their rehabilitation program will, of course, definitely, you want to see how this person can be away from these substances. That's one. Two, you want to get this person engaged in other healthy activities. So some people want to put them into some crafts that you can get them engaged in, recreational activities, sports. That the idea is to try and keep their mind busy and active.
For you to stay away from it totally, than for you to now start curing yourself from it.
Find a hobby, do something for yourself. You know what I'm saying? You can do painting, you can do
sports, exercise,
you can do exercise, yoga.
Crafts, yes.
You know, sometimes I feel like when people are idle,
a lot of bad ideas.
Experiments come with being idle.
You understand?
You start to imagine so many things.
Science students.
Yes,
you know?
Start experiment. Once you're idle, start to experiment.
Yeah.
Like either experimenting on the positive side,
the good ones or the bad ones.
It's always easier for you to experiment on the negative side.
The bad ones are so wide that you can easily fall and
because it looks more fascinating for many people
and easy.
All right.
Thank you so much. Thank you so much, Dr. Rotimi. Pardon me.
You're
It was a
welcome. You're
wonderful,
welcome.
wonderful session with you. And I'm very, very sure that even the audience will agree with us that it was actually an educative and insightful memory for us to actually go back and rethink upon. Thank you so much. We would
Thank you
actually
very much. Thank you for
look
having
forward
me.
to having you more. Thank you. So,
Thank you too.
guys, I think you said you would do the outro.
No, easy.
Well,
How are we going to do the outro? Okay, yeah.
Go now.
So, guys, keep watching. I mean, sorry, please. Okay, let me go
Prime
back.
Court
What's the
Studios.
name of
Prime Court Studios.
Prime Court Studios? So, guys, we have come to the end of today's episode of being aware of your surroundings. Yes, so this is actually brought to you, this program is actually brought to you by Prime Court Studios, and I hope you actually like, share, comment, and also subscribe for you to get updated on more episodes to come. God bless you and thank you for watching.
Thank you.
Bye.